Hi, everyone. Thanks for letting me join your class today. My name is Gillian Javetski, and I'm the Director of Partner Engagement at Dimagi. We're a software company that's focused on building mobile solutions to help improve the lives of people in some of the most under-resourced areas of the world. Today, I'll be sharing with you how we're doing this by building mobile applications that are designed to support community health workers around the world. So before we get started, I wanted to give a little bit of background on who I am. I worked at Dimagi for the past 4 years in different roles, ranging from partner engagement to communications and marketing, and also project management. So in my project management experience, I worked with different organizations to help develop and build mobile applications that they would then launch for their community health programs in developing countries. Before I joined Dimagi, I also had the chance to work with other organizations that were focused on developing technology to help improve lives in some of the world's more underserved areas. I feel really lucky to be in this field, and I'm excited to share this passion that I have with all of you today. So thanks for letting me speak with you. And here's a little bit of information about Dimagi. So we're a socially conscious software company or social enterprise. So unlike software companies that are focused on building the next mobile app that will go viral, like WhatsApp or Candy Crush, which we all love, we're more focused on building mobile applications that are designed for really low resource settings. And they're designed to help people that are working in those areas better deliver services to improve people's lives. We have 4 offices around the world. We're based out of Cambridge, Massachusetts. Our main contribution so far has been developing a mobile platform called Commcare, which I'll discuss later, and that you guys will actually have a chance to use in your class. All right, so to start the lecture, I wanted to share one of my favorite photos that we have at Dimagi. This is a picture of a community health worker in Kenya. She's meeting with one of her patients in her community who just had her first baby. In the picture, you can see that she's using a mobile phone, and she's using it to counsel the new mom about ways to take care of her baby. Like this woman in Kenya, around the world, millions of people rely on community health workers as their first source of care. Community health workers are often chosen by members of their communities or by organizations that support them. So whether it's in the United States or in Kenya or Zambia or Thailand, around the world, community health workers are playing an important role of reducing the shortage of doctors, nurses, and midwives to provide primary care services to people in their communities. What's even cooler about this is that they're pretty good at reducing that gap. Studies have shown that properly trained and supported community health workers can reduce neonatal mortality by 30 to 50%. But even though community health workers play a very important role around the world in providing primary health care, they often face numerous daily challenges. So today in this lecture, we're going to go over what some of those challenges are and how mobile technology is helping reduce them. So what kind of challenges are these? The first challenge that community health workers often face is that they have limited education and training opportunities compared to other healthcare professionals. In some cases, community health workers may not have more than a 3rd grade education. In other cases, they're often illiterate or have low literacy. And then on top of that, they're also expected to understand complex healthcare protocols. While that can be challenging enough, many community health workers rely on using paper as a way to keep track of all of their patients and work on a day-to-day basis. This can be difficult as they may be in charge of overseeing hundreds of people in their communities. Furthermore, community health workers often work in pretty remote places. So naturally, one question that may come to mind is, keeping in mind all these different challenges that community health workers face on a daily basis, are there ways that we can reduce those challenges? And is there a way that technology specifically can help? So while technology definitely isn't the answer to everything, and in some cases, it can even make problems worse. One area of global health that's grown more popular in the last few years is this area of digital health or mobile health, and better understanding how mobile applications can support community health workers in their day-to-day work. With more and more people using cell phones every year, there's been an increase in interest around better understanding how these cell phones can benefit community health workers. Today, I'll be talking about how my company, Dimagi, is working to understand that same question. We've built a mobile platform called Commcare, which is one of many digital solutions that are available to support community health workers in their day-to-day work. I'll be sharing what we've learned from the last few years of deploying Commcare to over 50 countries around the world, including what's worked and what hasn't worked. To get started, I wanted to share this video with you by one of our partners, Malaria Consortium, about how they're using Commcare in Mozambique to equip community health workers.
Since 2009, Malaria Consortium has been supporting the Community Health Worker Program of the Mozambican Ministry of Health in Inhambane province. Community health workers are members of the community trained to diagnose and treat illnesses, such as malaria, pneumonia and diarrhea in their villages. A year ago, a mobile phone-based innovation was introduced in 6 districts of Inhambane province to address 2 important challenges facing community health workers: to improve supervision, which is usually weak and irregular, and to improve the flow and use of data. The new system is called in-scale Commcare. It is a mobile phone application which serves as a job aid for each consultation, a patient's register, and enables better data collection and more interactive supervision. One of the functions that community health workers most appreciate about in-scale Commcare is the job aid, which uses images and audios to walk them through each step of a patient consultation.
Registrou que esta criança tem febre. Por favor, faça o teste de diagnóstico rápido de malária.
Many of the community health workers find that it helps them to remember all the symptoms to look for when diagnosing a patient. Community health workers also prefer the simplified respiratory rate timer, which is built into the mobile phone application. This helps the community health workers correctly diagnose pneumonia, one of their most challenging tasks.
A pneumonia é uma doença grave. É bom levar a criança de imediato ao AP para tratamento.
In-scale Commcare aims at ensuring good quality care, but also increases the credibility of community health workers in their districts and reinforces health education messages for households. All consultation data made by community health workers using the in-scale Commcare application are registered and sent to a server over the 3G network. This could replace manually filling in the register book and thus save community health workers a lot of time. Each week, the system sends a summary report to the community health worker supervisors, indicating the problems to be solved and the mistakes to be corrected. Through the closed mobile phone user group, the community health workers and their supervisors can have unlimited communication with each other. This is a great improvement for the community health workers who usually have just one monthly meeting with their supervisors when they go to the health centre to pick up their kit of medicines. Most of the community workers, equipped with the in-scale Commcare system, use the mobile phone to call their supervisors several times during the month to seek support. These interactions make it possible to ask questions, get feedback, and also to facilitate referrals to health centre when a patient needs specific care. The system also sends reports to the district, provincial and central levels of the health system so that they can immediately use the data submitted by the community health workers to identify and solve problems.
Dizendo que não fez TDR a 12 crianças com febre. A que se deveu?
Eu não tenho kit de TDR.
In future, this model could also be used to set up a community-based disease surveillance system, enabling data to be available for quick action. Almost 300 community health workers have been working in Inhambane province since 2010, of whom 132 are using the in-scale Commcare application. Community health workers treat about 5,600 children a month. The mobile phone application assists the work of the community health workers. It allows better interaction with their supervisors and facilitates better quality health services at community level.
Cool. So that video shows one example of how Commcare is being used in a project in Mozambique by Malaria Consortium. Like Malaria Consortium, a lot of other organizations around the world are also using Commcare to support their pre-existing community health programs. One thing you may have learned from that video is that Commcare is way more than a mobile app. It can sometimes be an entire health system. These are a few examples of how Commcare is used by community health programs to support their workflows. And this is what it looks like in action. As you can see, there's a lot of things you can do. So I think the biggest use case of Commcare is definitely for data collection. A lot of community health workers will go out in the field and use Commcare as a way to collect data about their patients. They can register their patients into the phone and then track them over time. They also often use it for counseling. So Commcare apps support images, audios, and video so that for community health workers that are working with patients that are maybe low literate or they want to standardize their behavior change messaging, they can provide counseling on the phone directly to them. Commcare also has workflow support functionality, which makes community health workers' jobs easier when it comes to following those complex protocols. Community health workers can also use Commcare as a way to reinforce their own training. And then in addition to benefiting community health workers, Commcare can also benefit organizations or supervisors that oversee community health workers. These supervisors can see incoming data in real time that community health workers are collecting, and they can also monitor community health worker performance to see which community health workers are out there and working and maybe which ones that need a little bit more support. So I want to go through a few other examples of how organizations are using mobile apps for their community health programs. But before we do that, I think it makes sense to go through a little bit of, at a high level, of how Commcare works. So no need to get in depth here. You guys will actually have the chance to build your own Commcare mobile apps down the line, so you'll learn plenty about it then. But at a high level, Commcare is designed in a similar way to something like SurveyMonkey, if you guys have used that, or even Google Forms. So the idea behind it is that with Commcare, you don't have to be a programmer to build a mobile app. So a lot of organizations are able to go on the Commcare website or hire Dimagi to help them out. So translating those paper forms into a mobile app on the Commcare website, download the mobile app onto Android phones, and then they give them to their community health workers after a few days of training. And then once community health workers are out in the field using Commcare, when they have phone connectivity or internet connectivity, that data is then uploaded to the cloud so that data can be seen at a higher level by their supervisors or the organization. If they don't have connectivity, which is often the case in a lot of remote areas, all data is stored onto the phone. So Commcare runs offline for this reason. And then when they do have connectivity, whether it's a few days or weeks later, it's then automatically uploaded. So I'll go quickly through this, but just wanted to show you what some Commcare apps can look like on the phone. So this app was used by an organization called Spandan, which is in India. They used it to build a maternal and newborn child health app. So this is a pretty common use case for Commcare applications where an organization will use it so that their community health workers can register a mother and her child to better track their health. Sometimes this is done during their pregnancy. In this case, it was used to just monitor the mother and child's health at the same time. This is an example of an app that was used during Ebola response in West Africa. So community health workers use this app to perform a variety of different tasks, including what you can see here, which is counseling the patients that they're speaking with about different Ebola signs and symptoms so that they're informed to seek healthcare if they exhibit any of these symptoms. And then one cool thing about this project was that we were able to integrate Commcare with an external reporting tool called Tableau, which essentially developed a mini disease surveillance system using Commcare as the data collection tool, and then Tableau as a way to report some of those results. And then this is an example of a screenshot from a Commcare application that's being used in Burkina Faso in 400 clinics across the country to monitor child health. This project is being run by the organization Terre des Hommes to improve child health outcomes in Burkina. Okay, so at the end of the day, having a mobile application for community health workers is great as long as it works. So one thing we really prioritized at Dimagi is making sure that whenever we put out mobile applications, we want to measure how well they're doing. So we really want to see how Commcare, if at the end of the day, Commcare is actually making not only the work for community health workers easier, so that they feel more supported and can rely on a mobile tool to do their jobs. But also that at the end of the day, that having a tool like Commcare is actually helping community health workers deliver better care so that their patients are exhibiting healthier behaviors and also that they actually have better health outcomes. So the idea behind Commcare is that by creating this mobile application, we want to achieve a few things. We want to make sure that community health workers can increase their knowledge of delivering healthcare, that they have improved decision-making as a result of having a mobile tool that supports them, and that on an operational level also that having a mobile application improves their efficiency and productivity and also improves the efficiency and productivity of community health programs as a whole. And then ultimately, at the end of the day, by having all these things in place, we want to see that having a mobile application in the hand of a community health worker also has an effect on health outcomes, which is the ultimate goal. Before I get into that, I wanted to just share a couple of other things that we do here at Dimagi, which is fun. So one of my favorite parts about seeing Commcare in action is not just when it's in the hands of community health workers as a final app, but also going through the design phase of what it takes to actually build an app that community health workers are excited to use. So at Dimagi, we have this thing called Design Under the Mango Tree, which is that when we go in to help build a mobile application that's used by community health workers, we want to make sure that we're engaging in user-centered design at all levels of usage. So that ranges from working with government ministries to ensure that what they want in the application is in there, working with organizations that are equipping community health workers with tools to ensure that the app does what they want to accomplish. And then finally, working with the community health workers themselves. So we want to make sure that an app that makes sense to the designer also makes sense to the user. And at the end of the day, it's really the user. And then probably most importantly, making sure that we're working with the community health workers themselves in the process of designing the apps, since they'll be the ones that are using them. So we've really found that you can have an incredibly beautiful, awesome, engaging, useful app, but it's nothing if community health workers don't have the buy-in or excitement to use it themselves. So it's really important to engage them at the beginning of the process all the way through when the app is in their hands. So in this image, you can see a Dimagi staff member, Mohini, is working directly with community health workers to map out the app that they want on a piece of paper. And then they go through several versions of prototyping to try different things and eventually end up with an app that they're really excited to use. One question that also comes up a lot is what really defines a great app in Commcare. So the great thing about Commcare is that there's a lot of flexibility to really build any kind of app that you want for a community health worker based on the features that Commcare provides. So there are over 100 organizations that are using Commcare in 300 active projects, and every one of those apps is very different. And so because Commcare is really customizable, we've been really interested in this idea around what are the best design practices for building an app. And I think one thing that we've really found is that it really does depend on the user at the end of the day. So here is a screen with 3 examples of apps that have been used in different projects. They're obviously very different. Some have been launched on a Nokia Java phone, or a brick phone, as you may call them. Some are on an Android phone. In some cases, there's color in the app. Some have icons and some don't. Your eye may go towards the middle phone as the most desirable app. But the reality is that for some organizations, they intentionally chose apps 1 and 3 for their programs instead of having a more engaging app. So for them, there was a benefit to having their app run on a Nokia phone for different reasons. It could be because Nokia phones use less power, so they were worried about their community health workers being able to charge their phones. It could also be that in some cases for community health workers, having an Android phone is a sign of status, and they didn't want their community health workers to face that risk potentially of having a more expensive object in their villages. The third app on the right is also an example of an app that's used by users that are completely illiterate. And so for them, they want to have boxes to indicate the steps in which they should go through a form. For them, when they sat down to design their app, they wanted to have chronological boxes to show steps 1 through 6 of protocols that they're used to going through. So they didn't want any color. They just wanted very simple iconography in the form of squares. So it's funny, what may seem really engaging for someone may be not for another person. So going back to the impact question, again, Dimagi's really prioritized a lot of effort around better understanding Commcare's impact. At this point, there are over 50 publications that show Commcare's impact on a variety of areas, including improving community health worker performance and then also having an impact on healthy behaviors and outcomes of their patients. So these are just a few stats, but Commcare has been shown to help community health workers increase their knowledge of healthcare areas, which is exciting. So at a really, really simple level, one huge benefit to community health workers when trying to get that buy-in for them to use Commcare is that we want to give them something that will save them time at the end of their day. So if they can do their job in 8 hours instead of 10 hours because they have a phone, then we want to make sure that we have an app that can support that. And for them, it's also a really great reason to use a phone and really love it because they can go through their day, provide the same level of care, see as many patients as they would have using paper, but they can get home to their families earlier. Commcare has also been shown to make community health workers more productive. By using a mobile phone instead of paper, we've also seen an increase in the number of visits that community health workers can take on as a result of Commcare. So in a day where they're working 8 hours, they can see more patients using Commcare than they could from using paper. And this is a really big one, but Commcare has also been shown to improve community health workers' decision-making. So the main reason for this is that by translating a community health worker's workflow from paper onto mobile phone, you can do a lot of things in a mobile app to ensure that community health workers are reducing the number of errors that they may write out on paper. So you can put in logic into an app. You can put in workflow support to help them guide them through their workflows. And then just put in a lot of different tools within the app so that they're providing better care and making better decisions. So just as there's a lot of positive impact about the role that mobile applications have in supporting community health workers, they of course also come with their own set of challenges. So I just wanted to go through and list a couple to keep in mind, both as you go through this class and just in general, thinking about digital health's role in supporting community health programs. So these are 3 challenges that really have stuck out to us at Dimagi, and we'll go through each of them. So in the first one, which is incentivizing health workers. So we touched upon this a little bit earlier, but at the end of the day, technology isn't the answer. It's a tool that can be used to support a pre-existing program, but it isn't the solution itself. So if you have a community health program that's not going well anyway, bringing in a mobile phone probably isn't going to solve the problem. You have to ensure that your community health workers are already supported with certain things and that they're already incentivized. So mobile phones can play a role in that. One example of this is, in a lot of cases, there's often a delay for community health workers to be paid, since they're often paid by the service that they provide. So in some cases, you see community health workers have month-long delays of being paid for the services, for the work that they're doing every day. So one way that phones are being used to incentivize community health workers is by using mobile phones. They can more quickly report the services that they're providing and then be paid more quickly. So thinking through different ways to design applications that just aren't useful or wanted by supervisors or organizations or government ministries, but ensuring that applications that are wanted by community health workers as well, since those are the applications that we've seen have really succeeded. So once you've tackled an issue related to ensuring that you have individual community health workers that are using applications, then the bigger question becomes, okay, we have all these community health workers that are using applications, but how do we further scale that? So scale can be defined in a lot of different ways. It can be by taking a pre-existing program and expanding it, so maybe going from like 10 to 50 community health workers. But as time goes on and more digital solutions are introduced into community health programs, there is a bigger question around how do we find the best technology to scale healthcare at a national level? So a few years ago, digital health was seen more as this kind of like fun, innovative, nice to have addition to a community health program. And in the last few years, I think with more evidence coming out, it's really starting to be seen less as an innovative solution, but really more as a must-have. So just as we have electronic medical record system mandates now in the United States, in the same way, having digital solutions to support healthcare in other countries is also becoming seen as a must-have, as a way to really improve healthcare around the world. So there are obviously a lot of challenges related to scaling some of these solutions, including what happens when you're working in a country where 95% of the population doesn't have phone connectivity. what happens if there's a successful project that resulted in a mobile app, but that was built off of a funding cycle that's now ended? So between financial challenges, implementation challenges, capacity challenges, there are a lot of things to think about for organizations when they want to take an app that they've seen has shown a lot of promise and bring it to scale. So in Dimagi's case, the largest project that we've had has been around 500 users. We're about to scale to several projects to thousands of users, in some cases tens of thousands. But this to date really hasn't been heard of for mobile health applications in low resource settings. So it's a really exciting time. We're going to see what happens, but it will definitely present its own set of challenges. And one thing to consider also when you're reaching scale is also thinking through, even as your system is beginning to reach scale, it's possible that people are still used to using their old systems. So they still may be relying on paper, or even at the same time as a mobile app is introduced, there still may be other issues related to like electricity, internet connectivity, training that go far beyond the mobile app itself. So we always say that phones are only part of the equation, but there are a million things that go into building a mobile app solution. So thinking through all those two can be a lot. And this translates into a bigger question as well. So as we've seen, having a healthcare app or a mobile app is one part of the equation, but in some cases, they really are treated like healthcare systems. To really ensure that these are actual systems and not just applications, we really have to think more about these like larger technical issues. So issues related to integration, issues related to medical reporting systems, issues related to standardizing systems across the country. So this is a question that we've faced as well in the United States in the last few years, and is one that's also coming up more in countries. But thinking of mobile apps not just as these kind of one-off solutions, but ones that can be successful and really need to be integrated into a larger healthcare system so that the value is seen at all levels. And also as a way to improve patient care so that patients aren't lost in the process, but they're able to be tracked at a community health worker level and then sort of seen their history of care seen at all different levels. I want to share a little bit about how Commcare works. So you'll get into this later in the class with your professor, but this is just a little sneak peek. So you go onto commcarehq.org, you put in your email information to sign up for an account. Once you verify your account and log in, you can go into the Commcare web portal. So here you'll see a lot of different options of things to do. What you're going to start off with is going to build an application. So once you're there, you'll have the chance to figure out what kind of app you'd like to build. You guys will get into this more down the road with the class and building your own apps. But for now, let's just say that we want to build a survey. So here you'll see that you can actually go into Commcare and build your own survey. So let's try this. So once you're in here, you can see that you can start adding your own questions to a survey. You can pick any topic that you want to survey, and then you can see throughout this that there are helpful questions around how to do that. So once you're done, you'll save your app, and again, you'll go over this in the class, but you'll be able to deploy it onto an Android phone. So then you can use the survey that you've built here on your phone to start collecting information. Once you've collected all the information that you need from your survey, you can then go back into Commcare and go to the report section. And then here you can see all the different types of reports that you want to see that have your data. So you can do things like look at reports that show how much data was submitted with Commcare and set up different parameters for those reports. You can even just look at the raw data itself and then download all of your data to Excel. So there's a bunch of things you can do. Then finally, another cool thing you guys will be doing for this class is using Dimagi's online courses to actually learn about Commcare. So this is through our Dimagi Academy. So you guys will be checking out and going through Commcare Fundamentals, which gives an overview of how to use Commcare. Then you'll also be going through an application building track that teaches you how to build apps with Commcare. That's pretty cool. So by the end of this course, you'll know how to go out and build a pretty simple but pretty useful app that you can show off to your family and friends. So that's it. I just want to thank you for listening. It was really fun to talk through this. I'm really looking forward to you guys getting a chance to actually go into Commcare in your second to last week and the last week of your class. I'm really looking forward to all of you getting the chance to try Commcare in the last 2 weeks of the course and actually go in and learn about how to use Commcare and then build your own mobile application. I think it'll be a lot of fun to see just for your own use case how having a mobile app could be useful in your day-to-day life, and then also see on the other end how organizations are able to use mobile apps in this way to support their community health programs. If you have any questions, you can check out our website. Thanks so much. Have a great day.